Thank you. I'm pretty much nervous, actually. So my name is Aleksandra. I'm from Serbia, and I'm a member of Association of Patients with Lymphoma, CLL, and MPN named LIPA. I joined LIPA because my own experience, I'm patient too. I got diagnosis DLBCL 10 years ago, actually. So during my life, I have been lucky or unlucky, depends how you look at it, that I have been looking at the healthcare system from different perspectives. First of all, as a perspective of patient, because I'm patient myself, then from different perspective as caregiver, because my father has a stroke and heart disease, and through the patient advocacy eyes from this point where am I today. And the three perspectives actually could be very different. So because of that, our work in LIPA is based on the evidence, and because we have some chance to bring our stories to all different stakeholders, but it's not enough because we need to have good evidence, right data, relevant data, and good data, right data, and relevant data. So first of all, I need to introduce our association. LIPA, as I said, is a national association. We work in Serbia and cover patients with lymphoma, CLL, and MPA. LIPA, founded in 2006, is a volunteer-based organization, and we have more than 1,000 members. We finished 32 projects, and we have 3 ongoing projects that we are working on right now. So in order to understand our situation on a region, Balkan region, I have to bring you a little bit explanation. It is very clear situation, actually. We have European Union countries inside our region and non-European Union countries. European Union countries in our region is Bulgaria, Croatia, Slovenia, and Romania, which is not on this slide right now. And they have access for European Union structural funds, and the rest of us, they don't have that funding ability. The healthcare reforms are still ongoing, and these reforms are actually very challenging. The health technology assessment no exists or is undeveloped for the most of countries. I need to turn back slides, sorry. One more. And the improvements of the quality of the healthcare service delivery system in Balkan is very slow. But with another hand, the patients' expectations are constantly in growth. But because of the low investments and the poor management of existing resources, overall service delivery lags behind the European Union norms. So it's still difficult for most of our patients to have access to even basic services, especially to new treatments. The second one is the law or the protection of patients' rights are not fully implemented, and most of the population has poor knowledge of his rights, and in many cases there is a lack of procedures that should help patients to put the protection on their own rights in some cases. In another hand, the most disease-specific organizations have weak to medium human resources because they don't have clear strategy, and most of organizations actually is the volunteer-based as we are. So we are familiar with that problem because of unstable funding. Patients' influence and their participation in decision-making process are weak and often do not appear as competitive and the real partners, especially in the eyes of the decision makers. So why does cross-border collaboration actually matter? Patients from these areas are very much appreciated the possibility to having regional cooperation among patients groups between Balkan countries. And this initiative would boost patients' efforts for the benefit of all patients, of course. And what are we doing? We're raising awareness and approving patients to have an active role in their disease management, share relevant data, solutions, of course, and know-how, engage stakeholders and target groups, and develop new partnerships. So, what is the biggest issue in our region? First of all, it's issue of access to new treatments, of course, and clinical trials, but it is access to diagnostics, new tests. It is access to services, recommended screening, and prevention services for all population. Information, ability to provide information about disease, patient rights, of course, when that is needed, and support, qualified, competent support providers from the patient groups to the medical staff and general public, because cancer diagnosis brings a social stigma. So it is a really wide perspective within countries, and we have seen many other factors that have influence to access. But the burning problem is issue of accesses to medicines, and many people still don't have access to essential medicines, mostly in developing countries as Serbia is and our countries in neighborhood. And this slide provides the rate of availability, and this is the number of medicines available to the patients in European countries started from 5th January 2023. Between 2018 and 2021, just 8% of the new medicines received a market authorization and approved in a reimbursement list in Serbia, compared with Slovenia 43%, Croatia 27%, and Bulgaria 33%. There is countries in our neighborhood. Some of the drugs which were supposed to be entered in the positive list 5 years ago is not innovative drugs anymore. These innovative therapies for some patients means better quality of life. For the other group of patients, it is a new chance, and for third group of patients, it's life itself, because they don't have any more therapies. So the availability of the drugs also means the doctors are behind their colleagues in European Union, because they don't have any experience with treating with new therapies. For comparison, Serbia is actually ranks first in the region of total health spending as share of GDP. But however, Serbia is in 4th place in terms of total health spending per capita. So this contradiction between healthcare spending and health outcomes is a result of several factors. Corruption, all equipment and facilities, poor quality of services, and long waiting list. A solution of such complex healthcare delivery problem like this is collaboration by all stakeholders, and solidarity is key, actually. Solidarity between patient groups in Serbia is often easily forgotten when organizations have same resources of funding. So we realized that our work locally can provide bigger picture, in our case, regional picture, and a small local organization, we knew that connecting with other groups in the region can make the patient's voice more powerful and ensure learning, experience exchange, and a lot of ideas and solutions, of course. And we joined forces first with Croatian and Bulgarian associations, and then with another association in our region. Just a second, sorry. And LIPA then organized the first regional conference in 2022 in Belgrade, then a second one last year in the city of Niš, and now we're preparing third regional conference also in Belgrade in November. So we collected data from different sources using questionnaires delivered to the patient representatives and advocates, not directly to the patients, to health care providers, hematologists, and the people from the relevant institutions, and collected the data from 7 countries, 3 European Union and 4 non-European Union countries. This data is health statistics, access to innovative treatments, now collecting almost finished general information about the number of patients, number of hospitals, doctors, study centers, number of patients enrolled in studies, and now we need to systemize all these informations. A result of all these activities is Atlas. Atlas is an online platform designed to provide specific and comparative information on Balkan health system, including data system performance and on access of treatment among the countries. This is a methodology how we collect this data, patient representatives, hematologists, relevant institutions, and the relevant sites, as I said before. Because the treatment and care are different, it depends subtype of disease, we compare treatment availability between the 4 most common subtypes, diffuse large B-cell lymphoma, follicular lymphoma, CL, and Hodgkin lymphoma, and some more rare diseases. And aim is to identify, understand, and overcome variation to access for treatment and the care in our region. So you can explore the data on the Atlas platform to understand access in your country and to create your own strategy for patients' advocacy plan. One of the key moments when you create evidence, you have to use this evidence properly and map stakeholder to present evidence to the right stakeholder, of course. This is the way to ensure policymakers that money spent to hematology is a good long-term investment and the return will pay back for the overall country economy. As you can see, the green squares are available therapy, red one is not available therapy in our region. And this is not done yet. It's just a start of the wider and deeper, more serious work for us. This is a start of systematic changes and pushing the strategy that the hematology is a medical area with priority in our region. Now we're trying to raise awareness to bring the strategy of hematology into political agenda and use local and regional data to make change happen. The second thing is we collaborate with stakeholders and we're trying to be confident, not aggressive, and build an ethical and stable partnership where we're treated integral and available partner in the process. And what is the key learning? Work as a team with all parties involved in healthcare, join forces with other patient organizations, have a good understanding of issues, collect empirical data, build a strategy to develop solutions, find what organizations are doing in your area, turn to media to exchange visibility, and don't be afraid to take an action. We hope that other organizations from all around the world can learn what we have achieved in Serbia and to advocate for change in their communities. Thank you for your attention.